My name is Brianna Sinclair, and this is my 17th week on HRT. Mostly on my channel I post transgender content. As of right now, it is solely my journey and going through this week by week. So if you like my content, please like, comment, subscribe. If you have any recommendations or want to see something unique, please let me know. That way I can give you my feedback, do the video that you would like. Or if there's a specific topic you would like me to cover, I can do that as well. But let's get into the video. Like I said before, this is my 17th week on HRT. This was the first week of my new regimen. They upped my spironolactone and my estradiol because previously they tested my levels and it came back as a 66 on the scale that they use to monitor, to measure the amount of estrogen in your system. So they upped my estradiol, and then because my testosterone was still high, they upped my spironolactone, so that way it can drop a little bit more, so that way my levels can kind of like match that female range. So quick measurements update. So this is my 17th week. My hips are 34 1/4, my bust is 34 5/8, my waist is 25 1/2. These are the exact same as last week. I expect the reason that nothing has changed in so long is because my body kind of got used to the regimen that I was on, stopped developing, or like I kind of expected, since my family's not really well endowed in certain areas, that my development kind of shut off, or came to a screeching halt. But with them upping my levels, I'm hoping to see more changes. As of right now, I've been on them for like 2 days, and I have noticed I have been significantly more tired. So to kind of counteract that, I have been drinking a lot more caffeine, so that way I can keep myself awake and continue to do everything that I would normally do. Just until my body gets used to it and I can wean myself back off of it, because every time I do have like a rough day or something like that, I do compensate that with like either some extra coffee or like a Monster or something like that, to help me get through my days. But that's that. So as of right now, since they they made it to where I take 3 of each every day. So that means in the estradiol I take 3 milligrams, and in the spironolactone I take 150 milligrams. So there is that. Cindy, you are just chill as a cucumber back there, aren't you? So that is it for my measurements and my new regimen. I do have another appointment in November, late November and early December, to potentially, they can monitor my levels again, so they could potentially either up my levels or lower them as necessary. It was recommended that I do get a blood pressure cuff, because the spironolactone is a blood pressure medication, and my blood pressure is already at the low end of that spectrum, so I am a little bit concerned about that. But I was told if there's any point where I'm experiencing like any fainting spells or anything where I am like losing consciousness or anything like that for short periods of time, to drop down to 2 and then climb back up. That was what was directed, to kind of keep my levels up but also not jeopardize my health. So that's it for my energy. I have noticed my skin significantly softer. I kind of took a nap today and kind of got to lay on like my arms for just a second, and I, for the first time, noticed that my skin was so much softer than what I remember it being. Because I do remember my skin being coarse and kind of rough. Today it feels like it's really smooth and really good, actually. And then my breast growth. My breast growth has it's still growing, but like it feels like it's growing more out instead of more like it's growing more like in diameter vice projection, which is perfectly fine by me. As of right now, I think they're like probably like this big. That's about maybe 2.5 inches in diameter, kinda. Maybe a little smaller. But at the beginning of this journey, I kind of set out not expecting any breast growth, to be honest with you, and was actually really surprised that I experienced any at all, because usually it takes like 6 months. I think it's like 6 months to 18 months is whenever you start to notice the maximum amount of breast growth that you will get. I might be wrong on those numbers, but I can look those up later. So kind of experiencing that really early on, like I think as early as like 1 month, I was really concerned because I was like, what is this? What's going on? But then after kind of like bringing it up, mentioning it, and bringing up the fact that like my chest would hurt, it still kind of does, but it's just tender to the touch. It doesn't like throb anymore, which is also kind of evidence that I feel like my breast growth had stopped due to my levels being stagnant. Or my levels just reaching where they're supposed to be. I have not noticed any fat redistribution. Like my breast growth, I don't expect that for a while. Well, I don't expect the fat redistribution. I didn't expect the breast growth. I haven't noticed my hair thinning out any more than it has. I have noticed that like the hair on top of my head, I find less of it in the shower and stuff like that, which is good because previously I had to take like finasteride in order to kind of preserve my hair, which is good. I was told that it can do that, but to look out for it. My exception to policy is still kind of in routing. I routed it late last week. So finally, I did get in touch with my primary care provider and asked him about like my certain physical standards and stuff like that, and he wanted me to go ahead and route it without that. Because initially I was led to believe that everything was kind of already preemptively taken care of, because I'm not the only transgender person that goes to this facility. But to me, it just seems like they're kind of dropping the ball a little bit, and I'm just trying to play the balancing act and keeping everything together and being patient and stuff like that. My coworkers are trying to kind of getting a little bit confused as to like why my exception to policy is taking so long, because I'm supposed to be given like a year in like social transition before I medically transition, and I just kind of reached my 4-month mark and I can't even grow out my hair yet. So I'm not 100% sure how my medical side is going to go, but I do know that even with short hair, I can look a little feminine with like a bob or something like that, which is kind of what I plan to do, and then just kind of like keep growing it out, get an occasional trim and stuff like that, and eventually I'll have like the length I want. Yeah, I'm hoping that because I've kind of done all the legwork, that my exception to policy does get through to everybody and gets through my boss and his boss and stuff like that. So that way everything is good to go. My emotional stability is very much the same. I haven't, even on the 2 days, I haven't noticed me getting any more emotional or anything like that. I haven't gotten any more sassy or angry or anything. I do think about things a little bit differently though. I have kind of noticed. Like, I do notice, like, I'll go more in depth into things. Like, previously, if I had a question, like, why is it this way? I would be satisfied with the answer of, like, it is this way because it is this way. And just kind of, like, press the, I believe button. Now I kind of, like, have this desire to know why things are the way that they are. So that way I have a better understanding, because that's just how my brain works. I'm not good with, like, memorizing numbers and stuff like that. I can, but I'm better at knowing concepts. So you may ask me, like, a mathematical question or a factual question where it involves numbers, and I'll be like, I don't know. But if I get asked, like, what is the idea behind this thing, I can be like, well, the idea is this, and practicality, it works out this way. So yeah, I have noticed that. I have noticed I bruise a lot easier. I still have, like, bruises on, like, my knee, as, like, that I'm healing from, that were really bad. My knee was, like, black at the beginning of the week, and now it's kind of, like, just faded to, like, this little spot right here. But other than that, Finny, did I cover all the bases? I think we talked about that. I'm just playing with you. Yeah, I'm pretty sure that's it. I was trying to keep my videos a little bit shorter because I was told that they were very long, so I try not to, like, drag them out and go into, like, these very long stories and stuff like that anymore, because I want everyone to enjoy my videos. Ideally, this channel turns into, like, a community where we can help and support each other. And at some point, I do want to do, like, a little sewing, like, playlist and stuff like that to kind of, like, guide people on, like, how they want to, like, how like, clothes work and stuff like that, because sewing did help me in my transition. I figured out, like, where certain measurements are and stuff like that, because previously, as a boy, you're really confined to only a couple options, and stuff. That's, like, small, medium, large, XL, and they're, like, largers, and then the XS and the smallers. In the female range, you do have, like, the same variations in size, but there are measurements that you can take into account to help you get the right size that you need. And in learning how to sew, I kind of figured out what those measurements meant and why they're so important. Because as a boy, I could wear a large shirt or a medium shirt, and as long as I could fit into it, it was good. A small shirt, not as good, because I couldn't really fit into a small most of the time. But in a female, like, setting, the small may fit weird, it may fit awkward, it may not fit at all. Whereas, like, a medium would, and in some other cases, like, the medium's too big and you'd have to go for a small and stuff like that. So I figured I would do that. And also, me learning how to sew kind of, like, helped me build up my wardrobe, because previously I was afraid to, like, go to the female section and go clothes shopping, because I would go by myself most of the time, and I would just be looking around in sizes that would resemble mostly me, and then I could play it off as like, oh, I'm buying this as like a gift for my girlfriend, or I'm buying it as a gift for my wife, or something like that. But I have learned like a neat little trick that kind of does make it seem a little bit awkward, at least mentally for me. And that's if you go to the boy section, you grab a random article, and then you can go to the changing room, try them on, and then take what fits, leave what doesn't, and then leave the boy item. So that way it kind of makes it less awkward for you, and nobody's the wiser. And this is just mostly so that people don't like backlash out at me, because if they see me like shopping for clothes for like a boy, presenting as a boy, it's a little less awkward whenever they're also shopping for girl clothes. So that's what I try to do. My whole thing regarding my transition is to make everybody as comfortable as possible, because I would like for us to get to the point where we can come out and say that we're transgender and nobody care. Because in reality, it doesn't matter. It doesn't matter. And if somebody sees a video, one of these videos, and says, you know what, I experience those same things, I think that I am trans too, they were probably going to transition later in life anyway, because that means that they were questioning their gender before even seeing my videos, or seeing other people's videos that remark on the same things. And that is my view on it. That might be a little political. I don't see it that way, but I apologize if it does come off that way. But yeah, that is my view. And I feel like because people do question their gender occasionally, especially in children, that's often brought up, and that's why children are such a touchy subject as far as transgender individuals go. I feel like it's just important for everyone to know all the facts and stuff like that, because lying lying always comes back to bite you in the ass. So even though people might be afraid of us and think that we're going to turn their kids gay or something like that, even though we don't care, at least I don't care. I don't care at all. I just feel like it's important for everyone to know the truth. And lying about what is the truth and what isn't the truth is not the way to go. Because the truth will be found out. Because time is going to go on, and transgender people have been around for so long. Long enough to influence culture in many places. Not just faraway places for me. It's been influenced in many cultures. And that's why I think it's funny whenever everyone says it's this new thing, it's a new fad. It's not a fad. I'm gonna have surgery that's going to make me feel miserable for the first couple days, because FFS, in all honesty, FFS at first looks good for the first couple hours. You're a little swollen, actually you're a lot swollen, and then the next day or two, all the bruising and stuff steps in, takes place, and a lot of them look like they're victims of domestic abuse. They'll occasionally come out with 2 black eyes, because that's what happens whenever you break the nose, and there's cuts, scars, the face is wrapped in bandages, and stuff like that. There's swelling everywhere. Some people can barely see. It's not a very gentle procedure or grouping of procedures, because FFS isn't like a procedure on itself. It's an overarching term to outline the concept of feminizing the face through surgeries that were originally done on cisgender people. Everything that is done in FFS is, except for like maybe the brow shave, was done as like on cisgender people and just adapted. And that's the way it is for most surgeries. Even like in my case, if I wanted to get SRS, that did have its roots in surgeries that were performed for cis women and stuff like that. And obviously we all know the BBL and the breast augmentation. The BBL stands for Brazilian butt lift, FFS stands for facial feminization surgery, SRS stands for sex reassignment surgery, and GRS, which is also the same thing as SRS, it's just another probably more politically correct way of saying you're going, it's probably the more correct term, politically correct term. That's what I'm trying to say. It's gender reassignment surgery. So you have sex reassignment surgery and gender reassignment surgery, because I feel like gender reassignment surgery is the more politically correct, because we do have the argument that we are making the distinction between sex and gender. Sex reassignment surgery is just more broadly known, and that's why I use that term, because it does get the idea across. It is not that it is changing your sex, because that's not what it's doing. It is changing your gender, allowing you to change your sex on certain legal documents and stuff like that sometimes. Other times you don't even need the full SRS. You can get just an orchiectomy in certain states, and that's good enough. And the orchiectomy is just a simple removal of like the testicles. And I think the only issue with that is you can't run for a couple days, and you can't jump for a couple days. But those are the surgeries, and that is what I plan to go through. So I get people's like concern for other people, but I feel like we're also losing track of like, if it's not hurting you or somebody else, why do you care? And that's where I think it's funny, is if it's not affecting you, you shouldn't really care. Like, if my siblings came out as like gay or something like that, I would say, that's cool. I'm gonna support you, because I don't care. Their personal life is their personal life. I have no cares like who they sleep with or like what their gender or sex is, because it makes no difference for me, because that's weird to care about that. And even if I had a son or daughter and they came out as transgender, or they came out as gay or something like that, I would well, if they're gay, that's fine. If they're coming out as transgender, depending on their age, actually not even that, they would have to go to therapy, and they would have to make the call, because I don't feel qualified enough to diagnose anybody. I didn't even diagnose myself. I was just sure. And I walked into my therapist and my psychiatrist's office at 2 different points, said, this is what I think I am, this is why. And they're like, I see your points, and I'm finding it hard to not agree with you and say that you are transgender, in fact, or have gender dysphoria. So, and after doing like all the research I did, because I wanted to be sure, because I had so much on the line if I was going to be transgender. I faced losing my marriage. I faced losing my friends, losing my family. I even faced potentially losing my job, because in my job, we're not really allowed to have like mental issues and stuff like that. So having a diagnosis is very hard to get through and say that it's going to be like only a temporary thing. And obviously my gender dysphoria like is a mental diagnosis, as it is in the DSM-5, the most current revision of the manual that we're on right now. It is recognized that it is supposed to be temporary, as the person that whenever they transition and they get to the point that they are more comfortable in their gender, their anxiety and their depression and everything that they're suffering from kind of like lessens, dissipates, it go away. And that is what we measure, like, and that's what we mean whenever we reference like quality of life. Our quality of life goes up whenever we transition. Like right now, I am happy to make these videos, and that might be why they do trail on, because I like sitting here in front of the camera making my little diary video every week. I get to get all dolled up for myself and get to be in my most feminine form, because I don't get to be that hardly anywhere else. And that's where everything's at. But yeah, this video I think has run on long enough. I'm trying to keep it shorter. But if you have any questions, comments, concerns, please feel free to reach out and I will address them personally. If you like my content, I would love for your support. Please like, comment, subscribe. I appreciate everyone that has subscribed and has decided that they're going to help. Because in my channel, I don't want any money from this at all. In fact, I would much rather donate it to some place to help transgender people and stuff like that. Like, I would rather donate it to a place down in Florida like Kamala's Closet. It's a little place where you can go if you make an appointment to help start your wardrobe if you're transgender, or to get like supplies if you're just having a baby and you're struggling. It's a very good place for even normal people, and that's the goal. Of course, like if I had like the money, I would upgrade my equipment so that way I can be heard better, I can produce better quality videos and stuff like that. But that's all I would do with it. Everything else would go towards charities, because even though I work 2 jobs and sure we need the money, I don't want that money. Money comes and goes. But the message that you send to people, that lasts forever. And this is my message, that I want to help the world be more accepting and to come to like a middle ground, so that way we can move forward as a society, because we're so busy fighting over who sleeps with who that we don't try and move past it and try and make advancement in where things matter. Like, we could make advancements in technology, medicine, and stuff like that if we weren't so busy bickering and arguing about like how certain things are supposed to be traditionally, socially, and stuff like that, because we are a society where the human race, we succeed or fail together. And that's how I view it. So, of course, some of my friends have different political beliefs than me. I don't bash them for it. If they're going to be disrespectful, I'll be more than happy to embarrass them, but they're entitled to their own belief. as am I. But if they're going to explain their side, they better be willing to listen to my side. So that way we can come to the middle ground. Anyway, please like, comment, subscribe if you like my content. This is Brianna Sinclair, signing off.